And welcome back to Wellness Wednesdays on the Morning Blend with Remedy Now. Studies show as many as 4 out of 10 women have some type of sexual dysfunction. So today, we ask a medical expert about common issues like low libido, arousal problems, and painful intercourse, plus how to treat them. Dr. Danish Siddiqui is a board-certified OBGYN and CEO of Remedy Now Health and Aesthetics. We're excited to see you. And before we move on, I want to mention that we're talking about a topic and sharing some visuals that are maybe for a more mature audience. So just a little caution there. It's great to see you.
Love to be here.
This is such an important topic, but I think it's something that women are very reluctant to talk about, even with their doctors.
That's true, and a lot of women suffer in silence. But let's go in the basics. Sexual response includes desire, arousal, and finally leads to orgasm. So anything disrupts in any of these issues, then that can cause issues with intimacy and relationship issues. Medical disorders like diabetes, we ignore those, but diabetes, anxiety, stress can also play a very important role in this. So I think understanding what the issues are and how to deal with it is going to be important.
Well, and I appreciate the fact that you brought up relationships because it affects somebody's quality of life. It affects their interaction with the people that they love. It affects their confidence level, how they view themselves. All of those things are tied into these issues that you're talking about.
And also the fact is that you don't need to live with these if you're struggling with these issues. I think we will talk about 2 non-invasive treatment options with the role of testosterone for certain women. So I think we can jump right into it.
Yeah, let's talk a little bit about some of the most common concerns that women experience, especially as it relates to sexual wellness. What do you see the most?
2 most important events in women's life is pregnancy and menopause. So after pregnancy, some of the women have issues like loss of sensation or vaginal laxity. Post-menopause or menopause have issues with declining hormones, has issues with libido, difficulty in arousal, difficulty reaching an orgasm, and painful intercourse. So now there is help. There are non-surgical options available for all of these women.
That's what's so wonderful,
Yes.
is that it's non-invasive, not painful,
Right.
things that can sort of easily be remedied in your office. So how is a hormone replacement therapy in particular contribute to improving sexual wellness?
So testosterone is declining in perimenopause and menopause. So it certainly it helps in boosting libido. It's like fuel to desire and libido. It just needs to keep it going.
Yeah.
So testosterone plays a very important role, and it is underutilized and overlooked. So
yeah. And is that something you test for?
So we do test for hormones for these patients, but if you're symptomatic, we treat them with various routes that are safe for women in that phase.
Tell us about this vaginal laser treatment. It's called Diva. Are you excited about it?
So we've been using it for a few years. Diva is a vaginal procedure that improves symptoms like vaginal dryness and vaginal tone and loss of sensation. So women, it uses 2 laser energies, and the non-ablative laser energy actually improves the natural lubrication, while the ablative laser energy improves the vaginal thickness and elasticity. So it is great for women who have vaginal dryness and painful intercourse.
And is it painful to have the laser treatment?
It is quick, painless, with no downtime. But more importantly, women who are breast cancer survivors who cannot use hormones, it's a great help for these women. Also, women who have mild symptoms of urinary incontinence, because of the laser developing collagen right underneath the bladder base, helps in the symptoms of urinary incontinence as well.
So all of those things?
All of those conditions.
Wow.
Absolutely.
And how many treatments would someone need to see improvement?
Usually a series of 3 treatments, 4 to 6 weeks apart.
Wow.
Yeah.
It sounds almost too good to be true, I'm sure, to your patients. What about this thing called the O shot? How does that benefit sexual wellness and health?
It's all about rejuvenation, reactivating your natural tissue. So it utilizes one's own growth factors and peptides by drawing blood, spinning it, using the plasma, which has growth factors and peptides, injecting it in the clitoral complex and in the G spot in the vaginal area. That improves the vaginal flow in that area, increases the sensation, so improves in the arousal and quicker, faster arousals and a stronger orgasm. So it is great for women who have issues for arousal and actually having issues with orgasm as well.
Wow.
So a combination of Diva and O-Shot can be good for lots of women in these category of patients.
And what about the Mcella? Because that's something else that you offer.
So childbirth, we have issues with the pelvic muscles being loose and lax. So it's all about maintaining a good core and a good abdominal core and a good pelvic strength. So in sexual wellness. So Mcella is great because it not only reduces the fat, but it strongly stimulates the muscles. Like 30,000 muscle contractions in 30 minutes. So it's making the pelvic muscles stronger. So I think that is very important for women who have issues with urinary incontinence.
Yeah.
So urinary incontinence can be a real issue with sexual wellness as well. So Mcella, improving the pelvic floor muscles, O-Shot, which works in improving the vaginal flow, blood flow, and working at the vaginal level in terms of increasing the vaginal thickness and collagen and elasticity. These are perfect combinations.
I bet you have a lot of happy patients.
They love it. Women are experiencing great results with all of these non-surgical, non-invasive procedures, which they can get it routinely in the office.
Such great education to you, Doctor.
Yeah.
Thank you so much
You're welcome.
for being here. Really appreciate your time. And check out these special offers from Remedy Now Health and Aesthetics. Just mention the Morning Blend. You're going to get $200 off the O-Shot, $200 off the Diva vaginal laser treatment, and $300 off 6 treatments of Mcella for pelvic floor strengthening. Here's the number to call. It's 262-404-9003, or you can email remedynowesthetics@gmail.com or follow them on Instagram.